Marianne Tierney is a nurse and a building biologist who directs Safe Tech Kids in North Carolina.
Hello, I'm Marianne Tierney, and it's such a pleasure to be part of this conference. I want to thank Dr. Kardaras for your active engagement in the lives of young people, helping them overcome their screen addiction. Dr. Kardaras is going to join us a little later in our session. Today, we're going to continue to address the challenges of behavior change with the actual use of wireless devices. And during this session, we are going to be working to overcome the dam of denial, helping patients advance their attitudes, practices, and knowledge on EMF exposures. My background for the past 30 years has been focused on behavior change, first as a public health educator, working at the individual, community, and policy level, and then as a nurse working with patients in early recovery from addiction to a number of drugs of challenge, and now as an electromagnetic radiation specialist certified by the Building Biology Institute. We know that many of our patients, if not most of our patients, are dependent on their wireless devices, if not actually addicted, and many of us have frustration around that, especially as we learn more and more about these health effects. We may even be frustrated with our own dependence on these devices. And because of this enormous challenge that we face, today we're going to be looking at what is considered one of the most widely used theories of behavior change, the trans-theoretical model, or the stages of change, which was developed in the late 70s by a team of psychologists, Dr. Prochaska, Norcross, and Di Clemente, who wrote this book, Changing for Good, which is a classic in public health and in addiction medicine. And that was developed with funding from the National Institutes of Health. Dr. Prochaska and his team focused on letting this be a guide for healthcare professionals to help patients quit smoking and conquer their addiction to alcohol and other drugs, as well as other complex health behaviors like weight loss. And we know that for smokers, it takes at least 20 to 30 times of trying to quit before they're actually successful. And it is usually the prompting, the coaching of healthcare providers, families, as well as natural consequences, often very significant chronic health conditions that prompt them to move through these changes. And so we're going to look at these stages of change and specifically how we will hear the patient talk about their own stage of change related to wireless technology. And much of the input from this slide and from these words that you'll hear that we've gathered from patients have come from some of our faculty here at the conference, as well as some of my building biology colleagues. In pre-contemplation, where the patient has no intention of changing their behavior, we'll hear, I can't do that. I need to stay connected to my kids all day. Or if there was a problem, I would know about it. Or the FCC says this is fine. Or radiation is everywhere. You got to die of something. We'll see closed body language and poor eye contact. In contemplation stage of change, where the patient is aware of a problem, but they have no commitment to action, we'll hear, I may hardwire my home, but my partner, he'll never go for this. Or I have heard this before, but I can't imagine how I would do it. Or I'm on the fence about this. Some of you in the audience may feel like that. Or it seems like I'm getting a headache when I use my phone, but I just can't imagine how I would do my work without it. In preparation stage of change, where there's an intent on taking some action, we'll hear, I will buy a headset this week for my phone, or I've been texting more since I heard about this problem, or we're turning off our Wi-Fi at night, but we still use it during the day, or when my kids are around, I have my phone on airplane mode, or I don't keep my phone in my bra anymore, and yet that same person is still carrying the phone in her back pocket. Both in contemplation stage and in preparation stage of change, these two can go on for years and years and years unless that patient is coached, is prompted to move on. And there are very real and perceived barriers that the patient is sharing when we listen, and those are opportunities for coaching, okay? When we look at action stage of change, this is when they're actively modifying their behavior, the patient will use terms like I am using a hardwired connection to the internet. I do use a headset all the time, or speaker mode, and yet we know that those same patients may be still relying on their phone as their cell phone as their primary mode of communication. And unfortunately, we often see this with electrosensitive people who are suffering from consequences and yet still dependent on that device. In maintenance stage of change, there is sustained change. They're proud of it. We'll hear them say, please call my landline. I only, check my cell phone once or twice a day, or I keep up with this and I'm trying to get my kids to stop. They're very motivated to help others. And then there's the reality of relapse. And the relapse typically happens when there's a change of situation, a change of job, a change of home, a change of income, and they're falling back on old patterns. Or if their knowledge is limited, it may be a gift, like somebody gives them a Fitbit or an Alexa for Christmas, and they didn't realize what it was emitting. And so that is an opportunity to get back on the wagon. And fortunately, what the stages of change teaches us through this research is that a patient who has already moved to maintenance and then relapse can learn from those relapses and quickly move back to preparation and action and maintenance stage of change. So I encourage you to think about first, what stage of change are you at related to this? Because that stage where you are at can affect your willingness to coach your patient forward. To move through these stages, we want to collaborate with the patient in order to make sure that they have knowledge about the problem and a positive attitude about the problem, and then the ability to actually solve the problem. And this is classic with addiction behaviors, that we'll see some knowledge, we'll see a good positive attitude, but the practice is where the rubber meets the road and where things fall apart, where we have a big disconnect. In fact, there's very little research about knowledge, attitude, and practices related to the use of wireless devices. And so how do we do that? How in the world of addiction do we do that? We use something called motivational interviewing. And this is a perfect opportunity with dependence and addiction on devices to use this same technique. And our concept, the whole purpose here is that we are really working to build rapport with the patient so that they feel empowered and feel supported to make these changes. And so the principles of motivational interviewing are collaboration with the patient. We're not telling them what to do. We're meeting them where they're at. We're figuring out how to help them get over their real and perceived barriers. Evocation, or evoking their internal desire to be well, to be healthy. And then their autonomy, making sure that they feel power, they have knowledge and skills to be able to do this reduction of their EMF exposure. And so we do that with expressing empathy for the road that they've been down. We develop discrepancy, and this can be a little bit tricky. Sometimes with a patient, I'll hear that they're highly motivated, and yet they have a real roadblock to moving forward. And so I will point that out. We're going to roll with resistance when they keep saying no to different options. We're not going to get mad. We're not going to walk away. We're going to keep providing opportunities, keep pressing on calmly and in an engaged manner so that we know we're still on their team. We're going to support their self-efficacy so that they feel confident that they can do this. And we're going to use open-ended questions and affirmations when it's appropriate to do so. And when we do this, sometimes something kind of magical begins to happen. Dr. Victoria Dunkley, who presented at our last EMF conference, she is an integrative psychiatrist who wrote Reset Your Child's Brain. She says that the permission phenomenon is a dynamic that occurs when someone confirms an internal belief we have that goes against societal norms or beliefs. Confirmation or validation gives us permission to act on that belief. And we are going to see all of those things in action when we do a role play in just a moment. And before then, I'm just going to hit a few highlights of things to make sure to do while you are talking to patients about this. Make sure to assess the patient's stage of change as well as your own stage of change. Be brave and vulnerable with this. It's hard to talk about at the beginning, but the more you do it, the easier it will get. Dr. Brene Brown, who is a social work professor and well-known author, said that vulnerability sounds like truth and feels like courage. It was the vulnerability of Magic Johnson, the renowned basketball player who in 1991, when he learned he was HIV positive from heterosexual sex, actually shared that with the press, with the world. And I was a public health student at that time, and he shared it with us at the American Public Health Association annual meeting with 20,000 of us present. And the shiver down my spine and the tears of relief in the room were palpable that finally someone stepped forward and let us know that he contracted this and that we could too. And it was a huge shift in our history that more and more people began to understand that they were vulnerable too to HIV infection. So I encourage you to be vulnerable. If you have been affected by this, if you have a family member who's been affected, share that, because this is so hard for people to believe, and yet do it very briefly and then shift your attention right back and your concern right back to the patient. This is not about us, this is about them, right? We're going to give the patient choices. We're going to suggest 1 to 3 actions, but we're not going to give them a long list of to-dos unless we know they're highly motivated and fairly advanced on those stages of change. We're going to basically work on risk reduction, and we're going to do that with triage. The triage here is we want the phone off the body and we want the Wi-Fi off for sleep. That's going to give them the biggest bang for the buck here. We're going to use an EMF meter to show the wireless radiation. Some of you have been purchasing one of those. Some of you purchased one of those through the conference, and that can show them hands-on how that radiation is measuring on their device. You can utilize your staff for this. You can utilize a nurse, a support person. You can have the patient connected with the EMF specialists in the area. And you can also, this is really important, is to provide resources for them. Make sure that before you leave the conference that you've got the top 10 studies that are relevant to the common conditions that you're seeing in your practice, and you can print off for those patients the abstracts for those studies and let them dig and learn more. You can make sure to have written materials. The Environmental Health Trust has some beautiful materials on their website that you can download for free. And then lastly, make sure that they have the access to reliable websites. There are websites, again, like the Environmental Health Trust, Physicians for Safe Technology, Jeremy Johnson's EMF Analysis, EMF Portal. I just have a list of those reliable websites on the back of my business card, and that way it's easy for a patient to follow up. We don't want to tell them to just go do a Google search, because they will find a lot of things that are contradictory to the reliable science. And then wrapping up here, we don't want to skip this issue because it's unpopular. Just like if we were on a beach and there was a child, a baby that was being sunburned, and we had sunscreen with us, we would offer that sunscreen to that parent. We don't want to pressure patients with scare tactics, things like, I'm surprised you don't have cancer, or, you could die, or whatever. We don't want to say things like that, because it puts a barrier up, and our goal right now is to reduce any barriers and open the patient's desire for change. We're not going to recommend a lot of EMF's to-dos, as I've shared earlier. We're going to remember that they are watching us and to be the change that we long for them and in the world. And we're never going to give up, even if we ask them 10 times to do this, just like we know with smokers. Repetition is key. And the more we address this, the more they'll realize that this is so important for their health. Robert Louis Stevenson, the Scottish author, said, "Don't judge each day by the harvest you reap, but by the seeds that you plant." So we're going to show you what this looks like. We're going to do a role play. Cece Doucette, who is the conference's outreach coordinator, and I are going to do a role play in which she plays a doctor shopper, a woman who has had a terrible time with anxiety and insomnia. She's been to a lot of doctors. She's kind of at her wit's end, and we are going to help her look at some new alternatives. And then Dr. Kardaras is going to come back and show us how he addresses his GLOW kids with an intervention. Thank you so much. I'm grateful for this opportunity.